Doyenda, and good afternoon, everyone. I'm excited to provide updates and highlights from ANTHC's Community Health Services Division. I'm Weather Potovan, and I'm honored to serve as Senior Director of Community Health Services. And I'm an enrolled tribal member of the native village of Tanana. My family comes from Tanana in the Fairbanks area, though I grew up in Juneau. Community Health Services provides programs and services to promote health equity at every stage of our life. Our team monitors population-level health data and supports programs focused on health issues Alaska Native people experience. These programs provide health education, training, and technical assistance to partners. We also host the training centers for all 3 health aid disciplines. Here's a quick look at some of our key accomplishments we've achieved over the past year. I would like to start with the health aid training centers. We all know health aides are the heart of the Alaska Tribal Health System. They deliver compassionate care in villages and sub-regional clinics, serving communities all across the state. ANTHC provides training, credentialing, and continuing education for all 3 health aid disciplines. That's community, behavioral, and dental health aides. Beginning with the Dental Health Aid Training Center, over the past few years, they've been expanding their courses. And I'd like to spotlight one of their key changes over the past couple of years, the Expanded Function Dental Health Aids course. This training equips dental assistants with the skills to perform cleanings, enabling them to provide more comprehensive care. This is valuable for rural communities that don't have access to a full dental clinic. In addition to the scheduled training that we host every year, we launched an exciting new partnership with the Yukon-Kuskokwim Health Corporation. Together, we conducted the hands-on portion of the training at their own dental clinic, successfully training 6 of their dental assistants. Once those dental assistants complete their preceptorships, they can apply for certification in their expanded skill set. This training will be offered annually moving forward, and if any tribal health organization wants to partner with us, please reach out to us by email. The dental team also partnered with the Distance Learning Network to create faculty calibration courses. These courses ensure that all instructors teach consistently, so students receive the same high-quality education each time, no matter who leads the class. This past year, we developed 5 courses, with plans to add more in the coming years. The team also launched a continuing education course for dental providers who are new to Alaska or the Alaska Tribal Health System. This course covers topics tailored to the clinical challenges they'll face in rural Alaska, helping them feel better prepared to serve their communities. Now let's talk about the incredible work happening at our Community Health Aid Training Center. This year, they strengthened their partnerships with the other health aid training centers at the Yukon-Kuskokwim Health Corporation, Norton Sound Health Corporation, and Tanana Chiefs Conference. Together, they've been reviewing and updating their curriculum and statewide documents. This is a massive effort involving teamwork and input from experts across Alaska. Once these updates are approved by the Alaska Area CHAP Certification Board, they'll bring meaningful improvements to healthcare for communities across the state. Moving on to the Behavioral Health Aid Training Center. A big congratulations to the team for successfully renewing their certification as a training center, a well-deserved milestone. The program has grown significantly. Just 5 years ago, we only offered 5 courses. Today, that number has increased to 52. We taught more than 3,000 courses, reaching nearly 1,500 trainees during that time. And the number of certified behavioral health aides increased from 63 to 99 during that same time period. We take immense pride in these achievements, knowing that each certified behavioral health aide represents a person with the skills and knowledge to make a difference in their community. The department also recently completed a 4-year opioid-impacted family support program grant, which made a huge impact. With this funding, the training center launched the Level Up program, partnering with 15 organizations to train 170 behavioral health paraprofessionals. This grant also supported the development of 14 new courses, ensuring that the training center now offers all of the courses at each level of a behavioral health aid certification. And the good news doesn't stop there. ANTHC actually recently received another 4 years of funding to build off of this work. Moving forward, we'll focus on increasing the number of peer support specialists and behavioral health paraprofessionals who support families impacted by opioids and other substance use disorders. Now I want to focus on the work that the health aid training centers are doing together to increase interprofessional education amongst health aides. A few years ago, we interviewed health aides from all disciplines to see what support they need and how ANTHC could help. The health aides shared that they wanted more training to better understand the work of other disciplines so they could better help other health aides and their communities. To support this learning, we hosted the first ever integrated health forum, bringing together over 250 participants. For the first time, we created a space where all health aides of any discipline could connect and learn from each other. The theme was Anchored in Wellness, and the event was a huge success. It set the stage for this year's forum, themed Strength in Togetherness, which just took place a few weeks ago. Our goal with these forums is to promote a deeper understanding of each health aid discipline's roles and responsibilities and is important for creating partnerships in real-world settings. Collaborative learning opportunities betters the educational experience for each health aide and builds the foundation for effective teamwork that benefits patients. Moving on to our work improving and building tribal public health infrastructure, which you would have seen on the screen earlier as part of our ANTHC strategic plan that Natasha was sharing updates on. So let's start with data. We all know data is important for program planning, and this year, the Alaska Native Epidemiology Center made it easier to access public health data by launching a Community Health Profiles dashboard. You can find it at epi.anthc.org. That's epi.anthc.org, and it's under the Health Data tab on that website. The dashboard shares demographic data and information on health indicators that can be searched by region and by year. We plan to continue to add new data points to the dashboard as we receive the data. If anyone would like to learn more about this dashboard, our public health data initiatives, or anything else, or would like a presentation on their specific region's data, please email us. Along with data, we all know that good research is also important to help us find answers to our top Alaska Native health priorities. In the past year, our research department received 2 large grants from the National Institutes of Health to help our research capacity statewide. The first grant is called a COBRI Award in the research world, which will help ANTHC support the Alaska Native Center for Health Research. The long-term goal of this grant is to help strengthen our research capacity on Alaska Native health priorities and allows us to bring in more Alaska Native people as new researchers. We are very excited to see what we learn from the 3 research projects that this grant will fund. The second grant will fund a project we are calling Health from Within. This grant will allow us to enhance our research in the areas of substance use, overdose, and mental health. Like the rest of the U.S., the health and well-being of Alaska Native people is linked to its colonial past. Despite the historical trauma of colonization, Alaska Native people continue to be resilient and connected to our cultures. We know culture is healing. We know fishing, hunting, singing, dancing, and speaking our native languages protects us. This grant will allow us to build research evidence that indigenous-based healing approaches help us address the impacts of historical trauma. Over the next few years, we will explore how our cultures are a protective factor and how we can integrate culture into our healthcare settings. Throughout the division, we have multiple networks and work groups established to partner and gather feedback to help support our own work and the work of our partners. Some of these networks include groups that are focused on tribal food sovereignty, tribal injury prevention, rural elder services, regional immunization coordinators, the Epicenter Scientific Advisory Council, and more. I'd like to take a few moments to share some highlights of some of these groups. The Cancer Control Program is working to expand their outreach, education, and technical assistance. The goal is to increase cancer prevention, and early cancer detection across the tribal health system. These goals are why the Alaska Tribal Cancer Advisory Network was established. In May, the network held its first in-person meeting to kick off the process of updating the Alaska Tribal Health System's 5-year cancer plan. We all look forward to reading the updated plan on this very important topic. The Injury Prevention Program this year implemented the Tell Your Health Story campaign once again, which honors suicide prevention awareness. The campaign encouraged people to take pictures or tell stories about how their culture makes them strong and how their spiritual well-being impacts their health. More than 500 people participated. We plan to bring this campaign back every year. Also this past year, the immunization program hosted a regional immunization coordinators gathering this past spring. It was also the first event of its kind, and it brought together professionals from tribal health, along with partners from the Indian Health Service and the state of Alaska. The gathering allowed coordinators to discuss best practices in immunizations, review current vaccine data, and also created a valuable learning and support network for those who attended. These events and networks help us gather feedback to enhance our own programs and the programs of our partners. They help participants grow their connections and learn new ideas from each other to increase health and wellness across the state. Now, last up is the work our behavioral health department is doing. The department focuses on promotion and prevention in a community-based setting. And some of you may be familiar with some of their work in the past. They are the department that does the Alaska Blanket Exercise, which is a participatory training that focuses on the impacts of historical trauma on our populations. We offer this training to tribal partners, the public, and all new ANTHC employees take this training as part of their new hire orientation. Now the department is working to have a trauma-informed approach with a healing-centered emphasis. This last year, we had 9 staff from the department become certified in laughter yoga. This combines laughter exercise with yoga breathing and mindfulness techniques. This coming year, the department will focus on protective factors, cultural pride, and healthy coping skills. This starts with including laughter as part of our healing and wellness journey, because not all of us get to listen to Natasha's jokes all of the time to help us with laughter. ANTHC, and thank you all for the opportunity to share these highlights.
Thank you, Weather. Such great work with the behavioral health aid, or all the health aid training, and great improvement on access to our epicenter. We're always trying to do data-driven based strategic planning. So I think it's great that the epicenter is offering presentations to your regions as you undertake your strategic plans. I think that's awesome work. So thank you so much to Community Health Services and all you do for the Alaska Tribal Health System.